improving sleep, how to choose the correct Chinese medicine formula. So I'm going to give you just we're going to go to the next slide, and I'm going to give you a quick overview of this talk. So today I'm just going to do a quick introduction of a little biomedical overview of what's called primary and secondary insomnia. Then I'm going to give you two really basic but absolutely essential principles, Chinese medicine principles for understanding disrupted sleep. Then we'll look at four Chinese formulas, four basic formulas that you need to know in order to treat insomnia. And then lastly, we're going to look at a case study, I think, that'll help clarify some of the distinctions between these different approaches to treating insomnia. So let's begin with primary insomnia. So just a real basic definition here. If you have difficulty falling asleep, staying asleep, or not feeling rested in the morning for 3 nights a week for more than a month, then you've probably got primary insomnia. You may have difficulty paying attention, focusing, remembering. You're quite likely to have some irritability, depression, anxiety, even heart palpitations and night sweats. So those are all sort of standard symptoms of primary insomnia. If you've got that for 3 nights a week or more, and it lasts for over a month, you probably have primary insomnia. Now, let's go to the next slide, which is secondary insomnia. Those very symptoms, however, may be caused by something else. And some of the possible causes would be pain, digestive disorders, sleep apnea, drugs, medications, stimulants, bladder issues, mental health conditions. So if your insomnia is caused by some of these other conditions, then we wouldn't call it primary insomnia. We would call it secondary insomnia in biomedicine. This distinction is useful for us because it maps fairly well onto kind of one really key Chinese medicine way of thinking about insomnia. So let's turn to some of the Chinese medicine explanations. And the very first thing I want to talk to you about is the spirit. So we're going to look at the next slide now. And in order to think about insomnia and disrupted sleep in Chinese medicine, we have to understand this concept of the spirit. So all practitioners know that the heart stores the spirit. So to give a little bit of an overview here, I've selected a quote from the Divine Pivot, which is one part of the Yellow Emperor's Inner Canon, and translated this for you. So the quote reads, "What is spirit? When blood and qi are harmonious, the constructive and defensive layers are open, the 5 organs are formed, the spirit resides in the heart. The hun and the por spirits are fully present, and then the person is complete." So in this passage here, we can see that that the spirit is both this sort of outward emotional and mental expression of one's inner physical health. It's going to include sleep, but also states of consciousness, the appropriateness of speech and actions and emotional response. So it's, in some sense, far bigger than some notion of the brain or something like that. It also is going to be something that we can see and grasp to some extent through our patients' eyes, their facial expressions, their use of language, their actions, their voice. And so this just gives us a little bit of an overview of spirit. I think most importantly here, it's sort of bringing together sort of both sort of mental and physical aspects of the body. So now let's turn to sort of what I consider like 2 of the most important reasons for within Chinese medicine for two of the most important causes, the two most basic causes of insomnia. So we'll go to the next slide. Actually, I think we need to go back one slide. We've skipped a slide. Oh, maybe, no, maybe, sorry, we may have lost a slide. Okay, let's go forward one slide. Sorry, okay, can we go forward one more slide? Okay, there we go. And then I'm going to back up to that previous slide. So in order to understand the Chinese medicine perspective here, I've selected a quote from Zhang Jingyue. He lived from 1563 to 1640. He's one of the most famous doctors and scholars of Chinese medicine, kind of a real towering figure of the Ming Dynasty, at least in the world of medical scholarship. He wrote this passage, which I think is very useful, very helpful for really kind of breaking down like the two key things we have to know about insomnia from the Chinese medicine perspective. And so he writes, there is not one single disease that causes insomnia, but as long as one understands the righteous and the heterodox, there is nothing more to it. When the spirit is settled, one sleeps. When the spirit is unsettled, sleep is disrupted. The reason it is unsettled is one, the disturbance of heterodox qi, or two, the insufficiency of qi and blood. Great, okay, let's go to the next slide, or maybe this is, yes, this slide, exactly. And so just to summarize that, in other words, kind of thinking of our 8 principal patterns here, we can think of insomnia as caused either by excess, and that's some form of heterodox qi disturbing the heart spirit, or we can think of it as some form of deficiency, where the heart spirit is unsettled because of this deficiency. Now, I want to make a quick note here, which is that it's, as always in Chinese medicine, things are a little bit more complicated than sometimes we like to, they are when we break them down. And so there are going to be frequent cases of sort of mixed deficiency and excess. And the clinical case I'm going to discuss with you at the end is precisely an example of that. Good. So next, I want to dive into the problem of deficiency. And I'm going to, because I've done a previous webinar on this, I won't linger on it too much, but just to kind of go over it, because it is absolutely essential to understand this in treating insomnia, but it's not the only thing. And so the problem of deficiency is absolutely crucial in thinking about treatments for chronic insomnia. And it's, and this is sort of that counterintuitive aspect of Chinese medicine. You might think of a patient who's deficient in some respect and therefore you would expect to be fatigued and tired and therefore needing sleep and being able to sleep. But it often works in just the opposite way. Because of deficiency, we often have an inability to retain or ground or root sort of our yang activity of the yang activity of our body. This is what kind of keeps us moving during the day. But when we get to the evening, we're unable to ground it, to root it, to bring it back into the body, and therefore the spirit becomes unsettled. So the kind of classic statement of this found in the inner canon is that yang does not enter yin. But this also corresponds very much to this idea that the heart cannot store the spirit. So the spirit is unable to return to the heart. And so that's at because there is some deficiency that, and therefore it cannot sort of retain it, ground it, root that spirit back in the heart, the organ itself. So that's sort of like the basic principle behind this, behind any kind of insomnia that's caused by deficiency. So let's go to the next slide. We'll go just a little bit deeper into what that clinical presentation will look like. And so if we were to do a bit of a pattern diagnosis here, these patients would often have a deficient heart blood or heart yin. And this leads to disrupted sleep, forgetfulness, as well as mental fogginess, inability to concentrate, heart palpitations, excessive dreaming, and sort of the problem of sort of being easily frightened or fearful. So those are many of the symptoms we kind of encountered in that description of primary insomnia above. Note here kind of how we've got this blending of sort of mental, physical, and emotional symptoms. And that's where this idea of like heart spirit is really powerful. And I've also got a little footnote here too that typically in our, at least in our textbooks, heart qi and heart yang deficiencies are more often associated with kind of the functioning of the anatomical heart, whereas heart blood and heart yin we think of as more related to like an insomnia presentation. So then let's go to the next slide. And I'm just going to sort of quickly talk about two of the most important formulas for treating insomnia caused by deficiencies. One is Gui Pi Tong, one is Tian Wang Bu Xin Dan. At Dao Labs, we sell the former as mental tranquility and the latter as physical tranquility. Gui Pi Tong is treats a deficiency of the heart and spleen and this sort of lack or insufficiency of qi and blood. Tian Wang Bu Xin Dan treats a deficiency of the heart and kidney, right? And also an insufficiency of the blood. So the key difference between these two formulas is one is really much more focused on spleen qi deficiency, that's mental tranquility. And physical tranquility is going to be more focused on a kidney yin deficiency. Let's go to the next slide and we'll look at the actual clinical presentations you would expect to find with these two formulas. So one tricky thing is that it's not always, easy to distinguish what is essentially sort of more of a spleen qi deficiency in the case of Gui Pi Tong or mental tranquility, and what is a kidney yin deficiency in the case of Tian Wang Bu Xin Dan or Dao Lab physical tranquility. But you might think of it just to be a little bit crude here as the difference between sort of cold and hot. With Gui Pi Tong, you're going to have a generally you're going to have an absence of heat. You're going to have patients who don't really complain about heat so much, but that's not absolute. Sometimes you will. They may have night sweats, but probably less intense than the Tian Wang Bu Xin Dan presentation. And they'll often present with sort of just a racing mind, excessive thoughts. They wake up in the middle of the night and they're just can't help but start planning the next day or the week or the month ahead. So there's a little gap here. So let me jump over to, and then we'll come back to those secondary, and then below that I have some secondary symptoms. Before I look at those, let's go over to the Tian Wang Bu Xin Dan column on the right. And just to compare sort of these primary symptoms, we'll look at the secondaries in 1 second. And so with a Tian Wang Bu Xin Dan presentation where you've got a kidney yin deficiency, you would expect to see more intense heat, you'd expect to see, and also this may present as hot flashes and a woman who's like struggling with menopause. You'd expect to see more intense night sweats. You would expect more agitation, vivid dreams, and in short, greater signs of heat. You might have some signs of heat with Gui Pi Tong, but in general, in general they're less common. Okay, let's then we've got some secondary symptoms here. So with Gui Pi Tong, you might have reduced appetite, you might have fatigue, a pale complexion. Gui Pi Tong is a formula that's great for treating irregular bleeding. So you might have some irregular bleeding, even some blood in the stools. That's another good sign that this is the right formula. And then lastly, the tongue can be extremely helpful here. So you would expect to have a pale tongue, a thin white coating, and it may be puffy and have a scalloped appearance on the edge, from teeth imprints. Going back over to Tian Wang Bu Xin Dan, you'll again see hopefully find other signs of heat. This could include nocturnal emissions. It might be hot and sweaty palms of the hands and soles of the feet. It's a classic yin deficiency sign. You might even have sores in the mouth or on the tongue. You could have constipation in more extreme cases. And the tongue should definitely be red and have either no coating or reduced coating, or perhaps sort of a geographic presentation where you've got patches of the tongue that lack coating and other patches that have coating. So that's a quick summary of those two formulas. Again, the distinction is between cold, it's on the one hand with the spleen qi deficiency and Gui Tang, and heat on the other hand with a kidney yin deficiency for Tianwan Buxing Dan. Now let's just go to a slide of the tongue presentation. This can be extremely helpful when you're looking at your patient. So if you see that tongue on the left, which is puffy and scalloped and has a white coating and is pale, you know you're on for mental tranquility. If you see the tongue on the right, which is red, perhaps a little bit narrow, has a minimal coating, and you might even see something even redder with cracks in it, then you know Tianwan Buxing Dan or physical tranquility is going to be a great fit for this patient. And you can feel pretty confident if these tongues match up with some of those clinical presentations we just discussed. Great. So that's all I'm going to say about Gui Tang and Tianwan Buxing Dan, just because we've talked about these a little bit more in a previous webinar. You can go to that webinar if you want more of a discussion of like the formula, and I break it down for you a little bit, and you can see that there's some overlap in the components of the two formulas, as well as some obviously important differences. Let's go to the next slide, and we're going to start talking about this problem of excess. So if you read Zhang Jingyue, he kind of gives you a list of like of the potential heterodox qi or pathogenic qi that's, you know, at the root of this excess. And so I've listed them here. I'm going to focus on just a couple of them, but he mentioned sort of wind and cold. You know, this would be like as if you got an upper respiratory tract infection, a cold, and you can imagine having disrupted sleep from that. That would be, however, though, probably, and you might have a cough or something like that to go with it. That, however, but it wouldn't be quite chronic insomnia. So I think it's not as much of a concern for us. Heat, now excess heat as opposed to deficient heat, that's very easy to understand how that would disturb the spirit. Phlegm and phlegm plus heat can also, this is also a common problem. They can disturb the heart spirit. Food stagnation is another big problem. We're going to talk about that in a second. And that can also be accompanied by dampness. And then rebellious qi. And I'm not going to talk as much about rebellious qi today, but obviously you see that's also easy to understand how that can disrupt the heart spirit. It might, and that may have a more chronic presentation, or it may be something a little bit more acute, particularly if we're talking about some emotional issues, some volatility, something comes up in your life and you're very upset. So it could be more short-term, or it could be more long-term. So for today's purposes, I'm going to focus in on basically heat, phlegm, and food stagnation, and try to help us understand two additional important ways to think about and treat insomnia. So in here, what's particularly helpful, I find, is this phrase from the inner canon regarding digestion. So there's a famous phrase from the inner canon that goes, "Wei bu he, wo bu an," and that translates as, if the stomach is not harmonious, sleep cannot be peaceful or settled. And so this is absolutely essential to kind of keep this in mind in your treatments of chronic insomnia. And so if you have patients with, you know, any kind of gastritis or ulcers or gastric reflux or colitis, any kind of digestive tract condition, so much bigger than just the stomach itself, at least as we think of it biomedically, then it's going to be essential to treat the digestive orders in order to resolve the sleep issues. So let's go to the next slide. We're going to talk about two related formulas that both that have some interesting overlap and can both be very helpful in treating insomnia. The formula on the left is Bao He Wan, This is the Preserve Harmony pill, and at Dow Labs we sell this as Digestive Harmony. And the formula on the right is Wendan Tang, and this is warming the gallbladder decoction. This treats phlegm and heat. I've broken down the formula for you a little bit here. Although they treat different things, there is important overlap, and I've tried to kind of show you the overlap in colors and show you the differences, or the differences are in color and the overlaps are in black. Both of these formulas have the same kind of root basic formula in it, which is called Arch and Tong, or two-agent decoction, and that consists of Fu Ling, Chen Pi, and Ban Xia. And I apologize, I'm bad with the Latin names here, so I'm just going to stick with the pinyin names for the names of the herbs. But Fu Ling drains dampness and strengthens the spleen. Chen Pi rectifies qi, and Ban Xia transforms dampness. In both formulas have this. In Wendan Tang, you have the addition of gancao, which is licorice, to kind of round those things out and harmonize them. So both formulas start with a little focus on dampness. But Baohuan does something different because it also has these additional herbs for reducing food stagnation. And that's Shanjia, Shenqu, and Laifuzi. And these three, these herbs are absolutely essential for reducing and guiding is generally the term, stagnation. So what is food stagnation? Well, I've written about this in other places on the website, but this is essentially kind of a useful way of thinking about what we might call indigestion in English, literally that notion of like sort of food not going down, not digesting. And so for any time you've got a patient who is struggling with any kind of indigestion, where you're going to see a lot of burping and belching and this sense of stomach acids churning and things like that, it's not hard to imagine that a patient like that is going to struggle with sleep as your stomach and doesn't seem to settle down, and the food is sort of just kind of that you have that sense of it sort of just hanging in the middle of your abdomen. This formula also has one other herb, which is lian qiao, which is used to drain heat. And so anyways, this is a classic formula for treating food stagnation, and just often really great for as a general formula for dealing with indigestion and other sort of basic digestive conditions. So that's one kind of formula to have in your back pocket if you've got a patient with insomnia, but also some really bothersome indigestion, and therefore like a food stagnation presentation, food stagnation pattern in Chinese medicine. Wendan Tang is similar, but it can kind of go beyond this. And sometimes these patients don't complain of digestive issues at all. And you'll notice that this formula, well, it's got the two-agent decoction in it to transform dampness. It doesn't have these other food stagnation reducing herbs. Instead, it's got zhishi, which is also can reduce food stagnation, but it's a very powerful herb for rectifying qi. In your clinical practice, if you're using bulk herbs, you might, depending on sort of the robustness of your patient, you might want to change that to qiao, which you could. It's a milder version of this herb, which comes from the skin of that particular citrus fruit. And it's also got another very powerful herbs for draining heat and draining dampness, as well as settling the spirit, and that's zhuru, which comes from bamboo. And so with these two additions, the phlegm transforming capacity of this formula becomes a good bit significantly stronger than a Baohuan. And then you also have this additional kind of ability to sort of settle the spirit. So you may or may not have, these patients may have some digestive issues. They may have some, they may very well have some reflux and things like that. But I've also had patients that don't, but that have really benefited from this formula as well. So this is a powerful formula. It's got some overlap with Baho 1, but again, it's different and really kind of zeroes in on the problem of heat and phlegm when they become intermingled. So these two formulas also kind of give us two other things to kind of think about when we're trying to deal with chronic insomnia that also have sort of presentations presentations of excess. And probably in all likelihood, these are going to be sort of presentations of like mixed deficiency and excess. So if the insomnia is chronic. So from here, I want to go to a little case study that I think is kind of really useful illustrating this. And I didn't use actually either of these two formulas because it was kind of even more complicated than those two formulas. But you'll see I had to really focus on digestion to kind of have success with this patient. So this patient is somebody I started treating about 2 years ago. A female who was 62 years old. And when we first started, her main complaint was anxiety and really anxiety and fearfulness, and really kind of to a very debilitating anxiety and fearfulness. Insomnia was a big issue, although I think she actually complained about it less than the anxiety because I think she'd just gotten used to it because it had been going on for so long. And she also had chronic diarrhea. All these things have been going on for at least 30 years. So that's a very long time. In addition, she during this time she had 2 instances of breast cancer, which she successfully beat. But that led her to do a double mastectomy just to kind of like so there wouldn't be a third chance. And so this is somebody who's been sick for a long time. Her tongue was pale and a bit narrow. It had a thin white coating on the back half. The pulse was deep and thin and slightly wiry. So based on this kind of simple presentation, my initial thoughts were, this is not a bad fit for Guipi tongue. This looks like a spleen, heart, qi deficiency. And I thought this patient might very well benefit from Guipi tongue, and Guipi tongue can be really great for treating anxiety and insomnia, especially when they come together. Plus, because it's got these additional herbs that address sort of spleen qi deficiency, I thought it might really be helpful for the chronic diarrhea. So let's go to the next slide, and we'll see sort of like the initial outcome from that treatment. Supplementing heart, spleen and heart qi, or supplementing the spleen and heart and qi and blood Guipi tongue is a blood supplementing formula that works by focusing on qi. There were some initial results. I think it was enough for the patient to kind of like be intrigued and want to continue, but it wasn't really dramatic. There was some slight improvement in anxiety. Fearfulness seemed to be a bit reduced. Occasionally, there were some stools that were formed, but as consultation, it was clear that most bowel movements, she had a very watery stool, and it would be as many as 6 or 7 times a day, and that was maybe a little bit reduced, kind of down to 3 or 4 times a day, sort of at best. But it seemed like that's about as far as we got with Guipi tongue, and it seemed like she just needed something more. As we kind of continued our discussions and with her improvement in anxiety and stuff like that, I think she kind of maybe gave me a fuller kind of description, or maybe I kind of tuned into some of the more details of her history here. And the big insight I realized was that she didn't just have diarrhea, but she had bowel movements accompanied by cramping. So that's a slightly different case than just diarrhea. And then she reminded me, that she has in the past been diagnosed with lymphocytic colitis. That was sort of maybe not forefront on our mind when we were first talking, but so there was this cramping, this colitis, there's something going on. And she also, as we as I was learning, also had frequent migraines. This was definitely a kind of a secondary point for her, but these were also very bad. And these two things became issues. So here then, I think with this point about the cramping and the lymphocytic colitis, we need to kind of think back to that famous quote from the inner canon, if the stomach is not harmonious, sleep cannot be peaceful, and deal with the digestive issues first. And also, as it turned out, I had to really deal with the migraines. So this took a lot of work. And let's go to the next slide and we'll see the final results. Or sort of the next step, which is here at this point, it was too difficult to continue with just sort of a pre-made formula, a pre-made patent medicine. So we stopped the Guipi tongue, although she sometimes would occasionally go back to it, I don't know, at various moments, but we basically switched to bulk herbs at this point where I could really fine tune and tailor that description to make it individualized for her, and really focus on the lymphocytic colitis and reducing the migraines as a key to addressing sleep and anxiety. And we should point out migraines are often understood in Chinese medicine as being caused by arrogant liver yang or liver wind or liver fire. So there's yet another excess too that had to be sort of addressed. So there's sort of an excess in the liver as well as some sort of excess in the stomach, large intestines that had to be addressed. So the herbal formula that I did, I didn't list it for you here because it's a little bit complicated, but I'll just give you the basic principles. Is that I continue to supplement spleen qi. That's using some of the very same herbs that are found in Guipi tongue. But then I realized it became essential to sort of drain some heat from the large intestine. This was kind of definitely connected with that cramping. At the same time, I had to warm the middle, but also kind of very gently. And I made the mistake of kind of using things that were too warming. And as a result, this led to sort of some really extreme migraines, actually migraines far worse than what she was used to. Typically, I think her migraines were sort of once a week or once every 2 weeks. And suddenly she had migraines that were lasting for a few days because I was using things that were too warming. So I had to use things that would gently warm the middle, moderately drain heat from the large intestine, and if using something too cooling could also be a problem here because we've got already a weak spleen, and cold draining herbs could further damage the spleen. So we had to be kind of very gentle with how we dealt with the heat and cold issues here. Then in addition, another kind of key principle here was to sort of dispel wind and to stringe the intestine. So just as that's more of kind of a branch, the latter is kind of a branch treatment to go with the root treatments. Like there are some herbs that are very sour and astringent that will help kind of like slow down and retain the stools a little bit. We had to dispel the wind, and you can think of any kind of acute moment where you're racing to the toilet to move your bowels. Suddenly, you've got sudden urgency to move your bowels. That's also like a wind. Both here, it's in the intestines, but also we have to think about the migraines too. You could think of that as a wind in the liver. So wind in general is something we had to kind of deal with. Again, just only needed a few herbs to deal with that. And then on top of that, I used a series of herbs to kind of supplement heart, blood, and qi. So you can kind of see here that the supplementing herbs, kind of there's a bullet 1 and bullet 5 are part of that. That's overlaps to some degree with Guipi tongue, but it got a little bit different in this formula. And then the middle 3 points are all points that are kind of essentially dealing with kind of various forms of excess in this patient. So we'll go to the next slide and kind of look at the results. And so basically, gradually but slowly, kind of with this approach, she just improved kind of week after week. And now kind of 2 years later, she's doing really great. We're still working, but she's doing really great. But her stools are totally regular and well formed. They're just once a day, which like to her is kind of an absolute miracle after kind of like running to the toilet a half dozen times a day for the last 30 years. Migraines have been more or less resolved. There haven't been migraines in just months and months and months. And the intestinal cramping is more or less gone. There might be an occasional time where she perhaps eats something that doesn't quite, or has a glass of alcohol or something, something that doesn't quite set well with her, and she'll have cramping for a day or two. But usually that kind of calms down pretty quickly. So then what's happened with sleep and anxiety, which is sort of the things that kind of brought me to her first. Well, sleep has improved like vastly. It's not perfect, but it's gotten much better. And she's getting roughly 7 hours per night. Sometimes it's 6, but sometimes it's more. She's still waking up a couple of times a night, which is more than I'd like. But the wake ups are short, and she's able to go back to sleep pretty quickly. So there isn't sort of what it used to be, which would be these huge gaps in her night. And I think I forgot to mention that, and maybe this was also even secondary to her initially, but essentially at the beginning of the treatment, she never slept for more than sort of like a 90-minute stretch during the night. So the 90 minutes was the most she ever slept. And then she'd be up sometimes for hours and might get another little stretch or two during the night. But she probably was getting more like sort of 3 or 4 hours of sleep total in a night. Now she's up to 7. Any wake ups are at least kind of minor and easy for her to get back to sleep. The fearfulness is gone, and there's still some anxiety, but it's far better than it ever was. It's so much more manageable. And so sort of anxiety and sleep are sort of like the two things we're finally kind of getting to now. But I guess the sort of point here is that we had to kind of deal with that digestive issues and these other cases, these other forms of excess that she was struggling with. So my little summary of the case here is that this is really a case of a combined excess and deficiency causing a chronic insomnia. And so it was essential to treat the digestive issues first. I didn't use Bao He Wan or Wen Dan Tong here, although at moments took pieces from those formulas. But it was only by kind of resolving the problems of mixed heat and cold in the intestines, eliminating the wind that was in both the intestines and the liver, was it possible to kind of get to the spleen and heart qi, heart blood deficiencies that were really at the root of her insomnia and anxieties. So that's the end of that case study here, and I thought this was a good time for some questions. I forgot to announce in the beginning that if you're welcome to send questions through there's a question and answer function or a chat function, and if any of you we're not too expert at this question and answer function, but if you've got any questions, try that and we'll see if we can make it work. So at the moment, I don't see any questions. So I think we'll wrap it up here, but I want to say that it's been a pleasure talking to you about some basic principles of treating insomnia. This webinar is going to hang out in our resource room at the Tao Labs website, but we're also going to expand it into like a fuller course on treating insomnia, and it'll be something that we'll have available for you hopefully in the near future, where we kind of really go into it at an even more deeper level. So once again, thanks to all of you for listening. Thanks to you for your interest in Tao Labs, and look forward to speaking to you next time.